Hi, my name is Sherry Bailey. Today my video is going to be on continuity of care. So continuity of care describes the movement of a patient from preventative care to hospital care to rehabilitation to general medicine. It is crucial for patients to be able to transition their care from home to hospital back into the home. In my organization, case management rounds with all the doctors on all the inpatients. That's when they determine during the hospital stay whether the patient has any needs that the case manager can assist with, and then if there's assistance needed, the case manager begins helping. Transition of care can be a very vulnerable time for patients because the information that is crucial to the patient's health can often be lost in that transition. One unique and interesting program that my organization offers is follow-up care by nurses for specific diseases. One of those diseases is COPD. When a patient with COPD is admitted, they are visited by the case manager, like all patients are. The case manager collaborates with doctors, nurses, and other specialty care personnel to decide if any assistance is needed in the home after the patient is discharged. When the patient is discharged, the nurse educates the patient thoroughly about their COPD medicines, anything that they might need. And then shortly after the patient returns home, there's a call made by a nurse in our organization that just talks with the patient about the care. They discuss if the patient picked up their medicines, their new medicines that they might have been prescribed. They discuss if the patient had made their follow-up appointments already. They also discuss the discharge instructions in general, if they understood them, if there was anything they were confused about. They then have subsequent follow-up phone calls for, I think, a month or so after the patient is discharged, where they'll talk about the symptoms that the patient is having. The nurse will also go over certain parameters, like this is when you need to take your PRN inhalers. This is when you need to see your doctor, like if your symptoms aren't being fixed by your inhalers, you need to see your doctor. And then she also goes over when the patient needs to report to the ER. I believe services like this are really excellent. I believe it greatly impacts patient outcomes and that continuity of care. Patients are able to be reminded of instructions that they received that they may have forgotten in the transition from the hospital to home. Implementing services such as this helps to improve patient outcomes and their experience. I think it just makes them feel a lot more cared about, that they know that someone's following up on them. Improved patient outcome and experience leads to higher satisfaction. It can also lead to increased CMS reimbursements, which because they're not having those readmissions as frequently, which can lead to raises for employees and higher staff satisfaction. So overall, services like this can definitely improve the bottom line of the hospital. Quality healthcare includes accessibility, affordability, timeliness, and caring, among other things. All of these factors definitely intertwine together. However, timeliness plays a big role in quality of care. There is a certain time that's allotted in the hospital for certain illnesses. However, sometimes patients have comorbidities that can cause that time to expire too quickly. So CMS will say, if you have COPD, you only have so many days in the hospital that we will pay for. After that, you have to have more of a reason to stay. Well, sometimes you don't necessarily have more of a reason to stay, just that the patient isn't ready to go home yet. Sometimes it's not a problem and, there's a legitimate reason. Sometimes, like I said, the patient just isn't ready. Their health isn't ready, I should say. So in those instances, that's an example of when that timeliness can cause a decrease in the quality of care that the patient is getting. Sometimes it's not a problem, but sometimes it is. So the practice of linking hospital reimbursements to performance outcomes can be a slippery slope. In a perfect world, I do think it's a great idea. Nurses and doctors are trying their very best to make sure that patients are educated, they have the continuity of care that they need to stay out of the hospital, from case management, home health people, physical therapists, all those types of things. And in the instance where the patient is doing their very best to follow all the guidelines and recommendations from the doctors, I think that these reimbursements linked to performance outcomes can be a great thing. It can drastically improve patient care, but the fantasy that every patient will always follow the guidelines and recommendations the way that they should is just a fantasy. Sometimes you can do everything in your power as a healthcare professional to keep the patient healthy and out of the hospital, but in the end, patient autonomy really does rule all. Patients are always going to do what they want to do. For some patients, they really do genuinely care. They want to stay out of the hospital. They don't want to be sick. But for others, that's just not the case. Smokers with COPD, they're going to keep smoking most of the time. It's rare if you can actually get one to stop. The patients that don't take care of themselves and get readmitted within 30 days cause the hospital to lose revenue, which can cause the hospital to have to make cutbacks, which those cutbacks can cause a decrease in the patient's quality of care, either from short staffing or, just not having the supplies that you need, different things like that. That's why, in the end, I do think that linking reimbursements to performance outcomes is not a good thing for hospitals or for patients.